Excess belly fat, particularly visceral fat, the fat stored around internal organs, is associated with several dangerous health issues. Here are some of the most significant risks. 1. Increased risk of heart disease. Belly fat is strongly linked to a higher risk of heart disease. Visceral fat releases fatty acids and inflammatory markers into the bloodstream, which can lead to plaque buildup in the arteries, increasing the risk of heart attacks, stroke, and other cardiovascular diseases. 2. Type 2 diabetes. Excess belly fat is a major risk factor for developing insulin resistance, a condition where the body's cells don't respond well to insulin. This can lead to higher blood sugar levels and eventually type 2 diabetes. Managing belly fat is crucial for preventing or controlling diabetes. 3. Hypertension or high blood pressure. Carrying extra weight around the abdomen can contribute to high blood pressure. Visceral fat can cause the kidneys to work harder, increasing blood pressure and straining the heart, which can lead to serious cardiovascular problems. Increased risk of certain cancers. Research suggests that excess belly fat is linked to a higher risk of several types of cancer, including breast, colon, and pancreatic cancers. The inflammation and hormonal changes associated with visceral fat may promote the growth of cancer cells. Sleep apnea and breathing problems. Belly fat can contribute to sleep apnea, a condition where breathing repeatedly stops and starts during sleep. The excess fat can compress the airway, leading to breathing difficulties, poor sleep quality, and increased risk of heart disease and stroke. Liver disease. Excess fat around the abdomen is a major risk factor for non-alcoholic fatty liver disease, or NAFLD, where fat accumulates in the liver. NAFLD can progress to more severe conditions like liver inflammation, cirrhosis, and even liver failure. Metabolic syndrome. Belly fat is a key component of metabolic syndrome, a cluster of conditions including high blood pressure, high blood sugar, abnormal cholesterol levels, and excess body fat around the waist. Metabolic syndrome increases the risk of heart disease, stroke, and diabetes. Chronic inflammation. Visceral fat is metabolically active and produces inflammatory substances that can contribute to chronic inflammation throughout the body. This inflammation is linked to various health problems, including cardiovascular disease, cancer, and autoimmune conditions. Cognitive decline. Recent studies suggest that excessive belly fat may be associated with cognitive decline and an increased risk of dementia and Alzheimer's disease. The exact mechanisms are still being studied, but chronic inflammation and insulin resistance are thought to play a role. Impaired mobility and joint pain. Carrying extra weight in the belly can strain the lower back and joints, leading to pain and reduced mobility. Over time, this can contribute to conditions like osteoarthritis and chronic back pain, limiting physical activity, and further exacerbating health issues. Belly fat is not just a cosmetic concern, it poses serious health risks that can affect your quality of life and longevity. Reducing belly fat through a combination of healthy eating, regular exercise, and lifestyle changes is crucial for preventing these dangerous health issues and improving overall well-being.